I'm not a licensed physician and I'm not giving medical advice. But for some reason, a lot of licensed physicians like to prescribe people ACE inhibitors or ACE blockers. For example, losartan. I know several people that have taken that, um, and sadly, one of them did not stop taking it before it killed them. Luckily, the other people have stopped taking it. But that's a very dangerous medication, and the irony is, as I've heard from medical professionals, that it is the safest blood pressure medication that everybody should use because it has essentially no side effects. Um, as I mentioned to them, well, hold on, what did I say? Oh, yeah, so this is the catch to losartan. It kills your kidneys. So when someone who is considered an expert on pharmacology told me that it's the safest blood pressure medication, no side effects, everyone should take it, I mentioned that I know several people who got kidney damage from it. It was a rather sadly funny response they gave. Oh, well, if you have atherosclerosis, then it causes kidney damage from lack of blood flow. Oh, what a shocker. Most people who have high blood pressure have atherosclerosis. However, there's actually more to this picture. ACE inhibitors and ACE blockers affect angiotensin II. This is a molecule in your body that constricts blood vessels and increases blood pressure. These medications decrease that or decrease the effects of that. That's a good thing, kind of, in theory. It's going to help your blood pressure, and it does. The issue is angiotensin II is like 1,000 times more active in the kidneys than it is the rest of your body. And guess what? The kidneys are very sensitive to hypoxia. So if you take enough of an ACE inhibitor or ACE blocker to get your systemic blood pressure down to the normal healthy range, what do you think it is in your kidneys? That's probably why so many people, sadly, who take these medications get kidney damage, kidney failure, because it's dropping the blood pressure in their kidneys to an incredibly unsafe level. What's sad is, I've been meaning to do this video for a while, but I wanted to look into a bit in medical studies if they had documented the reasons for this. Now, I didn't look that long, but I'm looking into it in medical studies, and all I can find are positive studies on it, saying how great it is for muscle loss, blood pressure, kidneys, everything. That's very sad when in reality it's hurting a lot of people. It's killing a lot of people's kidneys. For some reason, it also, at least in several people I know, causes severe muscle pain. Now, I'm not sure what that reason for the muscle pain is, but the kidney damage, in all likelihood, seems to be the fact that it's probably dropping your kidney blood pressure incredibly more than your systemic blood pressure. Low blood pressure, low blood supply, low oxygen supply. Low oxygen means cell death. Cell death in your kidneys, not a good thing, especially because they essentially don't heal. Certain damage to the kidneys can heal, certain minor damage. But past that, it's not known if they heal. Perhaps they heal very slowly, but regardless, if you're not going to have the absolute optimal lifestyle, and optimal bodily environment to facilitate that very slow healing, it's not going to take place in all likelihood. If it's that slow and that minor, it means you would need the perfect environment in your body for it to work enough and you need to do it consistently. But that's just theory. We do know that minor kidney damage can heal, but we're not sure about more severe damage, like the damage that is seen in people I know who have taken losartan and ACE inhibitors. So yeah, there you have it. I hope it helps you, because it's really sad and it's crazy that all of these medical so-called professionals preach about these medications and they push them on their patients. And they talk about them as if they're safe and have no side effects. None. Everyone should take them. When in reality, they're extremely dangerous. And sadly, it causes irreversible damage to a lot of people. I even know someone that died from it. Yeah, of course, the doctors just write kidney failure. They don't write, we killed him because we prescribed a medication that wrecked the kidneys and killed him. Yeah, very sad how the medical community often either doesn't know what they're doing or just prescribes things anyways. There's so much negligence. Like, I know someone close to me who has arthritis in their hips, very bad arthritis, going to get a hip replacement, and they also have high blood pressure that has not been under control until very recently. And they, at the time they went into a doctor, their blood pressure was 150/90 every day. It's what it must have been at the doctor's office. And that doctor prescribed cortisone injections or some other synthetic corticosteroid. Yeah, it's not a good idea if your patient already has high blood pressure. You know, maybe if you figure out how to manage their blood pressure first, or even if this isn't as good, but even if you prescribe blood pressure medications along with the injections. But to give somebody with already high blood pressure corticosteroid injections, that is negligence. And negligence for medical people is a big deal. You are putting people's health and lives at risk. This brought that person's blood pressure up to about an average of 175/110. I was trying to figure out why their blood pressure got so high versus the last time I saw them, and then I remembered they got corticosteroid injections. Nothing else changed except for corticosteroid injections. Not rocket science. They are known to increase blood pressure. Person had 150/90, got the injections. Some days 180, some days 170, some days 175, sometimes 170, over like 110, 105. That's, especially 180/110, that's dangerously high blood pressure. Yet, these so-called medical experts, medical professionals, thought nothing of it. Person comes in with high blood pressure already, give them more stuff that raises the blood pressure, don't even check in on them, don't order them to measure their blood pressure, don't have them come in and check their blood pressure. I believe in always checking it manually. I don't trust the electronic devices. In my experience, they're not accurate enough. Now, of course, you get a sky-high number. Well, you know that even if it's not super accurate, it needs to come down. You get a super low number, same thing, but it needs to go up. But if you're trying to accurately determine blood pressure, I find that the only way to do that is with a manual blood pressure cuff and stethoscope. Yeah, so much medical malpractice. Very sad, because it ruins people's lives and can end their life. That is murder. If you choose to be negligent as a doctor and you damage someone or kill them, that is murder. I mean, if you kill them, then it's murder. And of course, a lot of these people would say, well, you know, they say this is good stuff. Medical studies, medical books say it's good stuff. But at the end of the day, you have a responsibility if you're working as a doctor to monitor your patients and see what happens in reality. It doesn't matter what your book says happens. It doesn't matter what your professor in medical school says happens. It doesn't matter what your coworkers say happens. I mean, hopefully they know because they're monitoring their patients, but sadly, it doesn't seem like many people who work as doctors sufficiently monitor their patients. Yeah, it's your responsibility to find out what happens in reality and to make sure you don't hurt anybody. So yeah, I hope this helps you. If you are currently taking an ACE inhibitor or blocker, or someone you know and care about is taking such a medication, not medical advice. I don't have a medical license, and even if I did, you can't give medical advice over YouTube. But, you know, if it were me, I would check on them, at least do creatinine tests for the kidneys, find out how they're doing, because these medications are very damaging and dangerous.